did they say?
Good morning.
Oh,
come on, you're out there.
Good morning.
Thank you. This is being recorded, so they have to know that we have live people. You're not just all cardboard, setups or something. So my name's Gretchen Lopez. I'm the chair of the Seniors Council. And I'm so happy you could join us this morning for this very important presentation. There's been a lot of discussion about our new Department of Health. So we certainly want to hear from them about their priorities and the special programs that they have for our older adults. I want to thank the county for hosting us, giving us this wonderful space to meet in, and also recording the presentation so that you don't have to take copious notes. You can always listen to it again. And if you have family members or other colleagues that need to hear the information, they'll be able to view it on our YouTube channel. So just get on YouTube and search for Seniors Council, and it'll be there in a little bit. Is there anyone here for the very first time to one of our meetings for the first time? Excellent. Well, thank you so much for coming. We appreciate you taking time out of your busy schedule to join us. I hope you find the presentation interesting and informative. And you return again sometime. I wanted to give you a quick Vintage and Vibrant update. Vintage and Vibrant is our all-day educational event. It's going to happen Thursday, September 28th. So a few months from now, our planning team has been working very hard for the past year, getting it together. We're lining up some exciting speakers. We have some special activities happening. We're going to be at the Pace Center, you know where that's in, Parker. Beautiful facility, all one floor, plenty of parking. We start at 8 o'clock and we'll end at 3:30 with door prizes. You'll see how lucky you are if you get there. All right, we have several handouts available to you in the back room over there, and I hope you signed in. And if you haven't yet, before you leave, our electronic newsletter is called First Friday Update. That comes out every first Friday, and of course that would mean tomorrow. And we have some interesting information about friendships and how critical they are to good mental health, good physical and mental health. And then a little promo for our presentation next month, which Tiffany will be telling you about in a little bit. Also, the Possibilities Playground in Castle Rock will be opening June 9th in the evening. They're all anxious to have you there. And the Senior Life Expo on June 29th over at the fairgrounds. That's always a very large and exciting event. It's free, lots of local resources there. So we're hoping that you can stop by our table that day. Also, we have a presenter series handout that gives you the dates and the topics and the speakers and where we're going to be for through October. So please pick up one of those. And then our flyer for next month when Tiffany is going to be telling us more about the libraries. So please pick those up on your way out. Feel free to take more than one if you want to share it with someone else. That would be great. Now I'd like to introduce Tiffany Curtin. She's going to be giving you an education update as our education chair and introduce our speakers.
Trying to get a better camera angle for those who are viewing from home. Okay. Welcome, everybody. It's nice to see a lot of familiar faces today and a couple of new ones. My name is Tiffany Curtin, and I'm our education chair for the council, and I also represent Douglas County Libraries. So as a representative of Douglas County Libraries, I also would like to give you guys a little updates on what's going on with the libraries. So as if you live in Castle Rock, or if you happen to drive down Wilcox today, you may have seen our, in its completion state, the brand new library. So the Castle Rock Library is currently closed as we prepare to demolish the old building, which had all kinds of plumbing problems, and it's really going to be great for us to have a new building that is functional fully. So the Castle Rock Library is currently closed. We'll be having our grand opening on August 26th of the new branch, and we really hope to see you all there for that ribbon cutting grand opening celebration. We'll have, some activities and maybe some snacks around. I'm not really sure what I can promise for that, but it should be a great fun celebration to get to know the new that new branch. And I also like to promote a few things going on and coming up at the library, being that we are now at June 1st, and it means that it's time for summer reading. And summer reading, of course, most of us know that it's a great opportunity for kids to help them stay excited about reading books that are fun for them. But we also want to let you know that and remind you that summer reading is a great family activity and it's good for all ages. So we do have like prizes at the end of summer reading for adults who participate that are good for adults to enjoy and possibly be able to win. So we do have our summer reading kickoffs coming at this Saturday at all of our operating branches. So not at the Castle Rock branch right now, but at all of the other branches, we will have activities. And we do ask that you register for that, so we have enough of the kickoff gifts to have for everybody who is coming. So we are well prepared for everybody. You can still register online if you're going to do that. Please bring the family, bring your partners, bring your friends. It's a good time, and it's always good to be excited about reading and just reading the stuff that we all enjoy reading, including our kids as well as ourselves. So good intergenerational excitement to be excited about that. And a little reminder, we still have a few great authors coming up that you might be familiar with. Lisa C. will be in Highlands Ranch on June 28th. And Luis Alberto Urrea, he will be at Highlands Ranch on June 24th. He's an amazing author. He'll be writing about, tying into his family history with World War II and his mother's role there with the book that he's promoting there. And we have a local author coming up in September, Mary Taylor Young, who, for those of you who might be into birding or bird watching, she will be focusing on her experience in that with her latest book called Bluebird Seasons. All right, that's enough ado about the library. There are a million other things that myself, as well as my colleagues, will be presenting to you next month at our session at the Parker Library. So we will be giving you a little bit more about some of the extra bonus things that we offer at Douglas County Libraries that maybe you're not aware of or don't really know how to get involved with. So hopefully we'll get you excited about those things at our session next month. So that'll be July 6th. And again, at the Parker Library. On August 3rd, we will have our first outdoor event. And this will be held at the Seven Stones Cemetery and Botanic Gardens. And we'll be hearing from Rebecca Holm. She's the director of the customer that care there and co-owner of the Seven Stones. And also she's a historian and will help shed some light on the historical context of that location. And it's very beautiful. So I know it's a cemetery, but it is also a botanic garden. It is such a beautiful experience. I'm really looking forward to that. There will be a sunshade, and we're counting on good weather. And then on September 7th, we'll be learning about the DRCOG's survey results and how that will impact older adults in Douglas County. And so now, without any further ado about upcoming things, you can also grab a flyer with more details as you leave, or it'll be in your updates on the first Friday for the next presentation. Okay, so right now I would like to introduce to you Laura Larson and Dan Stene. So they will be letting us know about the new initiatives with the Douglas County's new health department and a little bit about their fall prevention initiative. So come on up, Owen, Dan, and
Danny. Which one are you
Start
going to
with
use today?
We'll talk about that.
Okay. I interchange whenever I talk about him, so, all right.
Thank you, Tiffany.
Thanks.
Good morning, everybody. How are you?
Good.
My name is Laura Larson. I'm the Assistant Director for Community Health at the Health Department. I hope you're all familiar with the health department. Anybody not know that Douglas County has their own health department now? You're all familiar? Okay.
No, not really.
Not really. Well, you're gonna learn something then this morning. I'm gonna give you a little bit of an overview of who the health department is and what we're up to here in the county, and then I'm gonna hand it over to my colleague, Dan. He's gonna talk about important stuff, healthy aging and fall prevention. So, Luke, would you go ahead and advance to the next slide? And it's actually an embedded video. Please. And I have to check sound on that. No sound, Luke. You double check your audio settings. Technology, it's great when it works, and it's. If not, we'll skip it.
Give me just 1 minute, please.
Looks like Luke has his mute on.
These numbers.
Please let me know if this is working.
You know, Douglas County is the third healthiest county in the nation, according to U.S. News and World Report. We're obviously the healthiest county in the state of Colorado.
It's actually because of you.
These numbers are real because our citizens know how to take care of themselves.
You come here, live a healthy life, and raise your children the way you want to do it.
And it's because of who the citizens of Douglas County are that it made perfect sense for Douglas County to have a tailor-made public health department.
We get to build from the ground up.
It's like having a custom home. Instead of buying something that's just prefab that somebody else made that might be more custom to them, we're getting to build something that's custom for us.
We're not taking a system that's been around for 50, 60, 70 years and trying to, scrape away the barnacles and figure out what we want to do.
The first step was putting together a county board of health, and the second step was hiring an executive director.
Acquiring what is proving to be an extremely competent public health director.
We've gotten applications from all over the country, in fact, all over the world for various positions.
Your Douglas County Health Department is going to be transparent and responsive to the needs of the community.
One of our first criteria was making sure that there was a web-page portal.
So people can see what we're doing in almost real time.
We're going to tell you what we know, we're going to tell you what we don't know, and we're going to tell you what we think.
It's not gotcha. It's not telling people what to do. It's not compelling people to do things. It's providing information to people and letting them make decisions on their own.
You know, over the last 2 years, we realized that people don't understand what public health is.
Public health is community health.
Whether that's air, water, whether it's a pandemic, a virus.
If you go to a restaurant, if you go to a Starbucks, public health has a role there because they expect those services.
Anything that has to do with body art, that's a part of public health.
Childcare. And we know there's a lot of properties in Douglas County that have septic systems. On-site wastewater systems are under the purview of the Public Health Department.
I can't tell you how proud I am of all the work that everybody's done.
We've not had any hiccups so far. Everything is going smoothly.
I have been in medicine for over 30 years, and this has been one of the most collegiate, well thought out, well done projects I have ever seen.
Every dollar is targeted at a need. Every dollar is targeted at something we know is going to improve the public health in Douglas County.
I knew that we could get this done because the staff here at this county are amazing.
You never lose sight why we're here. We are here for the people of Douglas County.
Certain of it. So that gives you a little bit of an understanding, at least, of where our Board of County Commissioners and the Board of Health began our journey. Can you advance to slide 3? So we wanted to give you a better understanding of how our organizational chart works and just how we look different than some of the other health departments. As was mentioned in the video, the county commissioners and the Board of Health did hire Mike Hill, our executive director, in February of 2022 to lead the charge in developing our new health department. Underneath Mike, we have 4 leaders and 4 divisions, and we're going to go into a little bit more information about each of those divisions. We have health administration, emergency preparedness and response and epidemiology, environmental health, and community health. Next slide, please. So, health administration actually went live last June. So we just hit our 1-year anniversary today, as a matter of fact. And that started with vital records. So any birth certificates, death certificates for any person who has born or passed here in the state of Colorado can be obtained at our Castle Rock location on Wilcox Street. We also try to make it convenient though for others as well. So go ahead and advance those slides for me, Luke. You'll see here, in addition to being able to come into our office and get that copy within 15 minutes of arrival, from the time you fill out an application to the time you walk out with that certificate, you can also go online. So we know that coming down to our office isn't always the most efficient and effective way for folks to get information. So we wanted to try and make that more easily accessible by having those services available online. Next slide, please. So emergency preparedness and response and epidemiology was our 2nd division that launched, and that division launched last July. Next slide. If you're not certain of what epidemiology is, we want to give you a little bit better understanding of what they do. So our epidemiology team studies the distribution frequency pattern of health-related conditions and events. They consider it an observational science, and it's something that's applied everywhere. So this is taking a look at chronic diseases, communicable diseases, all sorts of disease prevention that happens in the county really happens with our epidemiology team. Next slide. So you'll see the role of our epidemiologists is really to both monitor disease as well as prevent the spread of disease. So monkeypox was something that they were working on pretty diligently last year. They took a look at RSV in the fall and in the winter. How do we work with senior living facilities to reduce the spread of RSV amongst our older adult population? They are absolutely navigating nuances. Diseases always look different as things go along. And there's a lot of navigation that has to happen with that. Part of what they do is utilize tools. They utilize data reporting and mapping to really help better inform us as a system so that we can help better inform the community at large. Next slide. We also have emergency preparedness and response. You'll see here that they are our emergency support function. So if we had any type of health incident, outbreak, anything that was happening here in the county, our EPR team is the one that's going to be responsible for that. They work hand in hand with our emergency office, Office of Emergency Management, our hospital partners, law enforcement partners. They are front and center with them, whether it's around making plans for types of disasters and events, or creating those relationships, or working through training opportunities. Last fall, law enforcement, first responders, and our EPR team did a training event around wildfire preparedness. We know that an event like what happened up in Boulder could absolutely happen here in Douglas County, just based on our climate and our demographics. So we always want to be prepared and stay ahead of the game as far as those types of incidents occur. Next slide, please. Environmental health was the 3rd division that went on board, and they launched in September of last year. We actually provide services in environmental health at both our Wilcox location here in Castle Rock, as well as at the Park Meadow Center. So we have a location right next to the DMV on Lincoln and Yosemite, and you can find us there as well. They have 2 bodies of work that we're going to talk about. Next slide, please. First is consumer protection. So our consumer protection team is based out of our Park Meadow Center location in Lone Tree. You'll see that they're responsible for a couple of areas of work. They have a retail food establishment program. So they're going into all of our retail establishments, doing inspections and licensing for our restaurants. They also look at spreading or preventing the spread of disease in both child care facilities as well as hatching partners. So they're working hand in hand with those facilities here in the county as well. Next slide, Luke. Water protection is the other body of work that our environmental health team is responsible for. They started with wastewater inspections, so they're looking at septic systems. You may know that here in Douglas County, we have a lot of septic systems, especially in our rural areas. And so the team is constantly going out, checking groundwater, checking out those septic systems, and supporting residents in that nature. What we've just recently added, as far as Board of Health approval goes, is inspection on public pools. Those are now open for the summer. We want to make sure that we're going out in partnership with all public pools and doing those inspections on an annual basis to make sure they're safe for yourself, children, and families that are taking part in that activity. Next slide, please. So community health, I'm a little biased because this is my division, so it's my favorite thing to talk about. We were the last division that came on board. We officially launched our services in January, so I still feel that we're relatively new in our infancy as far as our work goes, but we're very excited about the work that we're doing. I see within community health, the most important thing we do is build relationships. So whether that's with other governmental agencies, with law enforcement, with the school district, with nonprofits, we are constantly out in community, building those relationships and partnerships to help improve and just grow the work that we're doing. Next slide, please. So the first line of services that you may be interested in knowing about is clinical services. Part of what the Board of Health and the county commissioners charged us with doing was actually resourcing out our clinical services. So the health department does not provide clinical services directly, but we partner with Stride Community Health Center, which is a federally qualified health center in the metro area to provide clinical services to any resident that needs it. They have a location in Parker. They take public insurance, private insurance. They have a sliding fee scale for individuals that may not have insurance. And they see anybody from pregnant women all the way up to older adults, anywhere in between. So they're really there to serve the entire family and household. Specifically for our older adults, you may be interested in knowing that they do provide immunizations. So any immunization you need, whether it's a flu vaccine in the fall, a COVID booster, to get updated on other vaccines, Stride is a place where you can receive that. They also have a geriatric provider on board at their Parker location. And Dr. Jones is able to do what's called a TUG assessment, which really takes a look at balance and fallness in our older adults, as well as mentation assessments, looking at symptoms and signs of memory loss and dementia, as well as depression. Next slide. So, health education, and Dan's going to come up and talk about the good stuff here in a minute. We have a health education team, and you'll see that they're responsible for 6 different priority areas: chronic disease prevention, fall prevention and healthy aging in older adults, substance misuse, suicide prevention, sexually transmitted infections, and tobacco prevention and education. Next slide, please. Other programs that I just want to share with you in case you have neighbors, family members, grandchildren in your lives, we do have programs specifically related to them as well. We have a maternal child health program that is looking at pregnant women, as well as children and youth under the age of 18 and children and youth with special health care needs. We also have a nurse support program, and that program works in conjunction with our child welfare team over the Department of Human Services. So our nurses going into homes, doing home visits with families that may have been identified at risk, whether that's at risk for neglect, it could be at risk for nutrition ailments, all sorts of different things. Our nurses in there to do assessments, to provide education, and connect families to resources. And then we also have our special supplemental nutrition program for women and children. That program is for pregnant women, breastfeeding women with a child under the age of 1, and children under the age of 5. Any family that is either on Medicaid, SNAP, or TANF automatically qualifies for our WIC program. And it simply provides them a card that they can take to the grocery store to do food shopping every month and really help support their nutritional benefits. Those are our other programs. Luke, I think that's the end of my slides, but let me know if I'm incorrect on that. Last thing, just questions. We do have a website, as was mentioned in the video. You're welcome to visit us there. We have handouts in the back. We brought for you a resource guide. So it is available on our website, but there's hard copies back there as well if you need resources, financial resources, housing resources, legal resources. We tried to put together a comprehensive guide that would have all sorts of various information to support our residents here in the county. So that's a little bit about the health department. Any questions I can answer before I hand it over to my colleague, Dan? All right, Dan, you're up.
Thank you. Yeah, so first slide, please. This is the one that tells you who I am. So you'll notice there that my professional little signature line there says D. Owen. All my life I was Danny O, and then a couple of years back I decided I should use my middle name once in a while. Why should it go to waste? So I started changing my professional name to D. Owen. Truth is, family, friends, close workers, they know me as Dan. That's my nickname. You're welcome to call me anything you like. I am one of the community health educators. At the moment, there are 3 of us. We expect to have 2 more before the end of the year. And one of the things that's cool about being a part of this team is that we bring to it a fair amount of diverse skills and experience. We're different, but we work together and bring those various skills and such together to be an effective team. And by the way, I just have to tell you, working for Laura Larson is one of the blessings of my life. She is wonderful. So community health educator, let me tell you a little bit about who I am beyond that so you kind of get a feel for what I bring to the table here. First of all, you notice those letters after my name. Education-wise, I studied molecular biology at the University of Colorado back in the 70s. I got my bachelor's degree in molecular biology in 1979. After a few years of working in the clinical lab, I started graduate school in pharmacology, and I earned a PhD in pharmacology in 1988. At the time I was writing my thesis and defending it, I started medical school in 88. I actually finished my medical degree at the State University of New York at Syracuse in 1992. I made that move for family reasons. Up until that time, I'd lived in Boulder, Colorado when I moved, but the family moved there in 1965 when I was 10. So I'm kind of a Colorado boy. I just got back here, so happy to be back in Colorado. But after I finished medical school, I went to work for the Army. They paid for my education, so I served just short of 13 years in the Army as a medical officer. I left the Army in 2005 to make some moves for my family, and I ended up in Washington. I practiced emergency medicine there for about 5 years, and then I retired from clinical practice in 2010, and I went into what you might call the practice of administrative medicine. If anybody has a question what that means, I'll be happy to tell you later. But I did that for about 11 years, and then in May of 2022, I retired from that job. At that time, I had already moved back here so I could be close to my son and his family who live in Lone Tree. And that's kind of the education piece. Let me just tell you a couple extra things. So my very first job in healthcare was in 1971, where I took training as a nurse's aide, became an orderly at Boulder Memorial Hospital while I was still in high school. So I started learning about how to take care of sick people as a high school student. From there, I moved on to become an ambulance EMT for 5 years in Boulder County. I worked for A1 Ambulance in Boulder County for about 5 years. So I was a professional on the street ambulance EMT. So that's a rather different way of taking care of sick people. From there, I became a clinical laboratory technician. So I worked for 2 years at the medical school doing clinical laboratory work. That's what I was doing when I started graduate school. After I got through graduate school and medical school, I started becoming an Army physician. And I was in a lot of different roles in that capacity. When I left the Army in 2005, I was the chief of emergency medical services at Reynolds Army Community Hospital at Fort Sill, Oklahoma. And I retired out of the Army as a lieutenant colonel. My 11 years of doing administrative medicine was great experience that helps me in this job. The other thing that's useful about me and community health educator is that throughout my life, I needed to teach people. I was teaching people how to take care of themselves. I was teaching students. I did lectures. I was actually for a short time a professor in a nursing school. So being an educator is kind of part of my DNA. So I'm just really happy to now here be in a place where teaching people and helping them make healthy choices is, you know, part of what I do. And by the way, so healthy aging and fall prevention. I'm going to spend some time talking to you all about that. I am not going to tell you anything particularly new, really, when you get right down to it, because most of what goes into being healthy and preventing falls, they're making good choices. And most of us already know what those choices are. My job as the educator here is to remind you. Sometimes what education is all about is reminding people about things they already know. So let's get started with that. Next slide, please. Oh, by the way, that first slide did tell you a little bit else, something else about me. Just notice the game they were playing. So healthy aging. Healthy aging, you know, we think about aging sometimes as if it's a disease. It's not. It's a part of, it's normal, it's part of life. Growing older is a form of success, right? And we go through, you know, this common pathway where we start here and we end up here. And along the way, we get to make choices about how we live our life that will impact how long we live and how healthy we are as we live on that path, right? So I just have this here to remind us that we're all on this path. Every one of us, no matter how old we are, we're on that path. And what we want to be able to do is make healthy choices that make that path smoother. Next slide, please. I forgot that slide was there. You can tell this is the first time I've delivered this talk, right? The Fountain of Youth. This slide here, this cartoon here comes from the Saturday Evening Post in 1926. Back at that time, there was a gold rush type real estate thing going on in Florida. And so they were kind of making fun of all these old folks who were moving to Florida to try and find the Fountain of Youth, where, so, you know, supposedly Ponce de Leon was searching for it. So I put this slide here because I want to remind us of an important thing. There is no such thing as the Fountain of Youth, right? Right? No, everybody knows that. But again, we can maintain our health and maintain a more youthful ability by making healthy choices. So next slide, please. This is here to remind us about those folks that are so annoying about how they live to be 100 years old without making healthy choices. And the point is that, like this gentleman, I drank and smoked and did as I dang well pleased 100 years, and here I am still at it, right? We all know people like that. My great-grandfather and my grandmother on my dad's side smoked all their lives, and they both lived to be in their early 90s. And they were pretty active up to the very last years. By the same token, my dad's sister, my Aunt June, she also was a big-time smoker, but she died very young from the smoking because she developed really severe emphysema. And she was addicted to her cigarettes and smoking them with her oxygen on till the day she died, okay? The point is, my grandparents, they made some choices that we wouldn't consider to be healthy. Using tobacco is generally not a healthy thing to do. They did fine. My aunt, on the other hand, didn't do so well. And the point there is that making healthy choices doesn't guarantee your health, and making bad health choices doesn't guarantee that you're going to die young. The point is the risk, right? If you make healthy choices, your risk of dying young goes down. Your chances of living longer and living better go up. And that's why we want to focus on the idea of making healthy choices so that we can all live healthier and longer. So next slide, please. Okay, what a great slide this is. Don't those people look happy? I mean, this is kind of what we're after in our older age. We want to be able to smile a lot. We want to enjoy our family and our friends. We want to have active lives, be out hiking or exercising. But I want to point to this person right here for just a moment, okay? I mean, I don't look like that. Maybe that's an ideal, being really strong and vigorous when you get into your older years. But I want to warn you about this image and this phrase, new science of healthy aging. The problem here is that is often, for me, that raises a red flag. Because you get a lot of people wanting to sell you things. They're telling you, use our product. It's based on new science. It's going to help you live longer. And you know what? It's not. I'm a skeptic. Okay, I am a medical scientist. I'm a very skeptical medical scientist. And when I see images like this, I go, I'm not so sure. And when they're trying to sell me something on TV, I say, nah, if they're selling it, on TV, I'm probably not going to try it, because if I get the recommendation from my doctor to try the product, well, maybe I'll choose that. But if it's selling on TV, I'm very, very skeptical. And I want to encourage you to be skeptical too about these kind of things. By the same token, when we make healthy choices, we make the possibility of being able to live vigorously and strong better. So let's focus on that. Next slide, please. But I don't offer pie in the sky. So again, making healthy choices, this doesn't guarantee success. It doesn't mean everything's going to be great. And the truth is, let's go to the next slide. Suffering is inevitable. We're not here to talk about doing things that are going to make it so that your life is just peachy keen. We're talking about trying to do things that will allow us to suffer less and live better by making those good choices. Okay? Next slide. So here we are, 6 tips. I want to point something out to you, by the way, too. You notice who this comes from, the CDC. Now, there are a lot of people in our communities, and I'm kind of one of them, who really think the CDC kind of got a bloody nose recently by some of the things that we had to deal with during the pandemic and such. But the point here is that the CDC is a strong and vigorous, useful organization. They've had some problems. There are reasons why you might question some of the recommendations and such that came out there. But a lot of the material I am going to present to you here today comes from the CDC or the National Institute for Aging. And these are reliable sources on these topics. And I encourage you to take them seriously. And oh, by the way, if you ever come across something that's from a government organization like this, the CDC, or any other health information source, and you're wondering, thinking, do I rely on this? This sounds a little fishy to me. Guess what? You can write me an email. My email is going to be on the screen here a little later. It's back here. It's on our website. You can write me an email and I will help you figure it out, because I've been doing this a long time, about 50 some years. Next slide. Guess what? We're going to start with number 1. Does this look familiar? Hey, eat and drink healthy, right? That makes sense. So make healthy choices with fruits, vegetables, whole grains. How many of you have never heard of this before? Right? So my mom, this is what my mom taught me when I was growing up. She gave me these things called broccoli. I said, where did you get that? Turns out now I love broccoli and it's very good for me. Next slide. And the next slide. There it is. Now, when you're eating healthy, don't forget, there are things about not just what you're choosing to eat, but how much you're choosing to eat. So small portions, how can you do that? The way I do that is I use a small bowl. And then I eat one small bowl and I don't get seconds. But bottom line is, if you eat too much of anything, it's not healthy. So you got to have small portions to go along with these food choices. And those small choices will help you maintain a healthy weight. Next slide, please. Move more, sit less throughout the day. Makes sense? Who's not heard of that one? Okay. It's pretty straightforward. It makes sense. Next slide. The thing I want to remind you of is don't forget to walk. Because sometimes when we think about moving more and sitting less, we're thinking, oh, we got to go to the gym, or I got to do some kind of weights or barbells or things like that. Those things are good and useful. But bottom line is, if you just get up and walk, you do a lot for your health. And when we're talking about that, next slide, please. When we talk about not forgetting to walk. So we're only talking about 20 to 30 minutes a day. If you can get out and walk 20 to 30 minutes a day, every day or most days, you're going to do a lot to promote your health. The other thing is that you do want to be able to maintain your muscle strength, right? And so if you can do things that increase your muscle strength or preserve it a couple times a week, that's also very useful. And guess what? Remember the other topic we're talking about today, which is falls prevention? One of the most important things about not falling is maintaining your strength. Because if you've got good leg strength, arm strength, then you're less likely to fall. So these healthy aging tips feed into our falls prevention message as well. Next slide. I bring this up because, some of us have physical limitations that make it hard for us to exercise. And when you are suffering from various things that make it hard for you to exercise, there are guided exercise programs, maybe at your gym, maybe if you live in a facility where they have therapists that can come and help you. That can be really valuable for some folks. And so if you're in your head, you're thinking, I can't go walking because I can't do this, I can't do that other thing, perk up and find another resource, somebody who can maybe help you with your exercise. Next slide. Who's never heard of this? I'm sorry, but so if you happen to be somebody who currently smokes and you'd like to quit, and I would encourage you to quit, there are ways that can help you with that. Next slide. But I do not recommend this one. Now, the reason why I don't recommend vaping is because, one, as a pharmacologist, I'm very familiar with what vaping is about. It's a nicotine delivery device, and it does it using a vapor, and that vapor contains toxic chemicals. Now, sure, they're not that toxic. I mean, one of them that's used is actually a food additive. You can eat it. You eat it every day. It's in some of your foods. It's just it wasn't intended to be breathed into your lung, okay? The safety of these products is not well established. We don't know 10 years from now, 15 years from now, what sort of health problems might develop because of vaping. And I think it's on the next slide. Say it on the next slide. Yeah, it doesn't. Well, stay where you're at. The vaping products as a way of stopping smoking is still really not that well established. Most people who want to quit smoking can do so with assistance through either medications or counseling or both. And vaping, for some people, might make a difference, but for most people, it's probably not the best way to go. So, number 4, get regular checkups. Okay, we think about that. I want to point out to you that you go to the regular checkups for preventive services to start with, right? Sort of the reason for going. They can check your blood pressure. They can check your blood sugar. They can check your cholesterol. These are all things that if you get your regular checkups and you get these things looked at, you might detect a problem before it becomes a real problem. So it can, again, help you live longer, help you live better if you catch things and nip them in the bud. The next slide. I don't want you to forget about vaccinations, though. And I know that vaccines have something of a problematic reputation these days. But part of that preventive service is vaccines. And I'll tell you some vaccines that as a almost 68-year-old, Pneumovax. It helps prevent me or protect me from getting pneumonia, which is one of the primary killers of folks my age and older. Another one is shingles. The shingles vaccine is very effective at preventing people from getting shingles. And I can tell you, having taken care of many people in my emergency department who came in with the horrible pain of shingles, it's not something you want to have to experience. These vaccines are just 2 examples of things that can really help improve your life and help you avoid some suffering that you don't need to go through. By the way, there's a new vaccine on the market. It should be getting out to patients soon, and that's a vaccine against respiratory syncytial virus, RSV. We think, for me, from where I came from, RSV is a problem for babies, particularly immature babies. But it turns out it causes a significant amount of pneumonia in adults as well. So this new vaccine out there that can help protect you from getting RSV. So again, get your regular checkups, get preventive services, and don't forget about vaccinations. Next slide. Know your family history. That's very simple. If your doctor knows that your brother had prostate cancer, he may give you more surveillance for prostate cancer than if you didn't. Same thing with a family history of breast cancer. If you have 3 aunts and a grandmother that had breast cancer, maybe you need to have more surveillance to look out and make sure you don't have breast cancer. So family history is very important. Next slide. So the last one, brain health. That's a topic that's of interest to a lot of folks. Those of us who are older and we're experiencing some challenges with our memory, sometimes we're wondering now, is this normal or not? And we actually have a presentation that we may give in the future. I have some infographics on that talks about how you can tell the difference between normal memory changes that come with age and not so normal ones. And if you're interested in that, by the way, you can send me an email and I'll send you that information. But bottom line is when you're getting your checkups and you're talking with your physician or healthcare provider, that's something they can kind of go over with you to make sure that that's not an issue for you. I'm going to take one real quick stop. Anybody have a question before I go on? Okay, good. Next slide. Summary: eat and drink healthy, move more, sit less, no tobacco, regular checkups, know your family, don't forget. Those are the 6 tips. So remember, I'm trying to remind you here of things you probably already know, and you can think about where you might find some things you could change in your life that would fit into these categories. So next slide. Now we're going to move on to the fall prevention thing. First thing I want to show you something really quick. When I was growing up in Boulder, I had a lot of friends who were mountain climbers, okay? And they taught me something interesting that actually helps me today when I'm trying to think about how I'm not going to fall, like I almost did that one day in my apartment, right, Laura? Notice these people, they got a foot, and a hand. Foot, and an arm. That's called 3 points of contact. When you're in a position where you are at risk for falling, the more points of contact that you have with something stable, the less likely you are to fall. Now, this gentleman could put his hand on this rail, and she doesn't have a rail on this side, so she's only got that one. But if he goes up holding this rail and that rail, that gives him 4 points of contact. And that means when he takes a step, he's still got 3, okay? When you're in your home and you're thinking about ways in which you can make practical changes to help you not fall, remember, try and find at least 3 points of contact and put those features into your house. They will help you. I'm bringing that up now because it doesn't come up later in the talk, okay? Next slide. Everybody's got to have a trigger warning. So there is a trigger warning here because what I want to warn you about is that the next few slides are kind of scary because they give us some data, some information about people who fall when they're older, and it's kind of scary. I mean, it kind of frightens me. Look at this curve. This is old data. It's from 2016, but look at that curve, the death rates in the US in older folks. That is scary. And it's one of the reasons why we're putting an emphasis on trying to prevent falls in our senior citizens here in Douglas County, because we know it's an important thing, a thing to pay attention to. Next slide. So now we're going to go through some of the scary facts. 1 out of 5 falls causes a serious injury, such as broken bones and head injuries. This is called a Colles fracture. As an emergency physician, I saw lots of these, and most of them were in folks who are my age now, older folks, okay? What happens is you fall down like this, it breaks the bones right there. You get the end of the bone popped up here like this. This requires surgery. It can take months to heal, and it oftentimes results in chronic arthritis that makes it so you really can't use your hand. So you do not want a Colles fracture. So again, we take falls seriously because this is some of the things that can happen with that. Next slide. Each year, 3 million older adults are treated in emergency departments for falls injuries. That was something I saw a lot of. I took care of folks in the vehicle, and then later in my career, I took care of them when we got them out of the vehicle into the emergency department. This is just a number that we need to pay attention to. It says it's happening to a lot of us. Okay, next slide. Over 800,000 patients a year are hospitalized because of a fall injury. Most often, they are hospitalized because of a head injury or a hip fracture. Not good. Next slide. Each year, at least 300,000 older people are hospitalized for a hip fracture. This is a big deal because, as it turns out, elderly folks, older folks like me and you, when we fall and break our hip, it's oftentimes the first step on a downward spiral. Death following a hip fracture, even if the hip fracture is repairable and it's fixed with surgery and such, death following that hip fracture is very common. So again, we don't want to fall because we don't want to break our hip. That hurts. have to have surgery, all those things, but it also can be kind of the beginning of the end. We don't want that. Next slide. More than 95% of hip fractures, guess what? They happen when you fall, right? That makes sense. But oftentimes it's kind of a sideways fall. You slip on the snow, down you go, you land on the stair. So again, if you know this fact and you know that you're entering into a risky spot, you can avoid that hip fracture by taking some precautions. Next slide. Falls are the most common cause of traumatic brain injuries. Big surprise there. Next slide. Costs a lot of money. I'm not focused on the money. I'm focused on your health and my health, but it is worth remembering that this stuff costs money, and we'd rather be spending this money maybe on vaccinating our kids or getting them WIC nutrition or whatever, rather than spending it on us because we're falling. Next slide. I want to give you a little bit of a perspective on Colorado. So this slide shows data from 2020 on the older adult falls reported by state. And what you'll notice here is that nationwide, so everybody included here, about 1 in 4 adults age 65 or older report falling at least once a year. How many people in the room have fallen in the last 5 years? Yeah, the number is not zero. What about Colorado? Where are we at? You can see we're kind of in the middle of this blue, so we're not the worst, we're not the best. Next slide. We're number 38. I don't know, that doesn't sound like great to me. We're kind of on the bottom end. We're right at the borderline between the blue, the light blue and the dark blue. Another thing I want to point out to you here that's kind of interesting is look at Alaska. Alaska is one of the worst. It is the worst place where they have the highest rate of falls among older adults. The place that's best, Illinois, Hawaii, Connecticut, I think. So one wonders, yes.
Why would Illinois be so good?
Yeah, that's the question, right? Isn't that, right? And in fact, the difference between the best and the worst is twofold. So Alaska is twice as likely to have people fall as Illinois. Why is that? I don't know. I'm not sure anybody knows the answer to that, but it's just part of the facts. Good. Next slide, please. About 37% of the people who fall require medical treatment. So again, it gives you that impression that a lot of us fall, and when it comes to those of us in Colorado, we're falling more often than average. I don't know why, but again, that's one of the reasons why, as a health department, we're focused on this issue because it's important to our citizens. Next slide. So this is the worst of the scary details, right? This is falls that result in death. These numbers that I'm going to show you, like these here, these are deaths per 100,000 citizens. So for every 100,000 people over the age of 65, say 67 of them die from a fall. That doesn't sound like a lot, but in the epidemiology world, that's a big issue. Next slide. We're 45th. That's even worse. So not only do we fall more often than usual, but when we do fall, we're more likely to die. I mean, so we need to do something about that. Next slide. Must be addressed. Next slide. All right, let's talk about ways we can prevent or protect ourselves from falls. Next slide. How am I doing on time? I'm doing okay. All right, back to 6 more tips. I love this cartoon. It's got a lot of tips in it, all in one cartoon. We're going to go through it here in some detail. Next slide. So, number 1, talk to your provider about medication side effects. We have a brochure in the back on the table that actually gives you information about the kinds of medicines that make it more likely for you to fall. If you're taking a blood pressure medicine, and that blood pressure medicine brings your blood pressure down in a healthy range, but it also means that when you get out of bed at night, your blood pressure falls too far and you faint, that blood pressure medicine could be the thing that causes you to fall. So you want to talk about that with your health provider and think about ways to prevent that. One of the things, by the way, is going to come up later. If you're getting up in the middle of the night, get up slow. Next slide. So all of these are examples. Again, in the back, we have a brochure that goes into more detail on that. Next slide. Do strength and balance exercises. Remember when we were talking about healthy aging? We said move more, sit less, be strong. Well, because that helps prevent you from falling. Next slide. Doing things that help maintain your muscle mass and your strength and balance will help you with your walking and climbing ability. By the way, this muscle mass thing, there is a thing in medicine, it's a health problem, it's called sarcopenia. Sarco means muscle, penia means not enough. One of the things that happens to us when we get older, sort of a normal part of the aging process, is that we tend to lose muscle mass. Part of the reason for that is because we're not as active. Part of it is just part of the normal aging process. But if you can engage in exercise and activities that help promote maintaining muscle mass, that can really have a big impact on your health and your ability to avoid falling. Next slide. Okay, this is kind of common sense. If you can't see, it's a lot easier to trip on something, right? If you can't hear, that also can sometimes impact your ability to avoid falls. So getting your hearing and vision checked regularly to make sure it's up to snuff, good thing to do. Next slide. And make the best of those. Next slide. Home safety. This is one that I really want to emphasize. Some of our homes are not safe. We have electric cords. We have carpets. We have stairs with no rails. All of these things are like booby traps. They're like, obstacle course things. And so we have a tendency, a lot of falls happen in the home, and they happen because the home is not safe. Next slide. So you can, again, you don't have to be, Inspector Clouseau or Einstein or anybody like that. You can look at your home and probably recognize places where things could be safer. I'll give you an example. In my house, the thermostat for my apartment, my thermostat sits on a wall that's kind of blocked by a chair and a table. So the close call I was telling with Laura, I got up early in the morning, it was cold, I needed to turn the thermostat up. So I'm there and I'm leaning over the table to get to the thermostat. And I just woke up and I just about hit the ground with my face first. So what did I do? I moved the chair a little bit. I moved the table a little bit. So now I can step between them and stand right here and change the thermostat. It's not any more complicated than that. But if you want, you can get materials like from, I think, South Metro Fire. They have materials that can help guide you through a home safety inspection. You can actually have them come out and help you with that. I highly recommend that. Think about safety in your home. Next slide. Stand up slowly. This is number 5. I just mentioned that, particularly if you're on medicines, it can cause you to be lightheaded. Next slide. So again, the medicines can cause body changes that give you dizziness with standing up. You fight that by getting up slowly. So like for me, I get up in the morning, I sit on the edge of the bed for about 15 seconds, with my feet down, then I get up. Next slide. You'll notice that this gentleman is using a cane. Some types of ambulating or walking assist devices can be helpful. Notice what he's got here. 1, 2, 3. He's got 3 points of contact here with the floor. That's back to that principle of trying to have maximum number of contact points to help you with your balance and such. Next slide. So they can be helpful. Next slide. You have to use them properly. This cane, if it gets caught on an electrical cord, so you're walking along, you're using a cane, and you put it out and it gets on a cord and over you go. So your home needs to be safe so that your walking assist devices aren't setting you up for a trip. Also, if you don't know how to use the cane, and there is a trick to it, you can get some training from a physical therapist or whatever, and also particularly if you're using a walker, you can get help learning how to do those so that they don't cause the thing that they're trying to prevent. So next slide. Oh, summary time, we did our 6. So talk to your provider about medication side effects, do strength and balancing exercises, have checkups for your vision and hearing regularly, make your home safe, look for hazards, make a point of getting up slowly when that's appropriate, and then canes and walkers and assist devices can increase stability when they are used properly. Next slide. Back to the happy faces. So it's not new science. When I just got done telling you about healthy aging, about falls prevention, this is not new. I'm reminding you of things that you already know. But there is good science out there that is helping us learn more about the aging process, things that we can do to slow it down, perhaps create medicines that will assist us to live healthy longer. So I'm not denigrating science. I'm just telling you, when you see these kind of things, be suspicious. Next slide. No, how many people here remember this from back in the day, right? Keep on trucking. That's what we want to do. We just want to keep on trucking. Next slide. This is one resource that is available. They have these kinds of information packets and such. I have some of those resources on a page in the back of the room that will give you the internet links or whatever to go to those. So that can be helpful. And the last slide, I think. Yeah, there we are. I love these kind of paintings, don't you? So old and young, old and young, old and young. We're on a spectrum. We're on the path. We hope that these kids someday get to be, this person or whatever. I want you to remember that if you have a question related to anything that you think the health department should be able to help you with, you can write me an email and I will answer you. And that email is on the resource sheet back there. This is our address. This is, if you look for us, we're on the internet, on the web. And now, does anybody have a specific question for me? Yes.
This is an opinion question. I recently asked my doctor what source he would recommend online. Because we know we're not really supposed to Google and diagnose ourselves, but yet we do it. And he said no to WebMD and yes to Mayo Clinic. And I wanted to ask your opinion.
I agree.
Okay.
I do not use WebMD, and I do use Mayo Clinic.
Okay.
I use others. One of the things I have available to me is a professional online thing. It's called Up to Date. It's a subscription that I pay about $500 a year for. And if you send me a question, there's a very good chance I'm going to go to Up to Date to find a good answer. They're not perfect. Nobody is. But for instance, several years ago, I was in to see my doctor. I had a problem with my knee and I'm smart. I'm a doctor. I know what I need, right? And I said to my doctor, I think this is what I need. And she goes, well, I'm not so sure about that. And she went to her computer that was in her office and looked it up on Up to Date. And guess who was wrong? Yeah, it was me. So Up to Date is very useful. I use that all the time. When you're online, Mayo Clinic is a good source.
Thank you.
Yes. Any other questions? Yes.
So can you, both of you, can we have the PDF of your PowerPoints for the minutes?
Yes.
Yes.
Because that would be really helpful
Yeah.
for people
I would like to do
to
that.
follow along, especially if they're listening to it online.
Any other questions? Yes.
What do you see as the most concerning community health issue in this county at this point?
Do you mean related to seniors or overall?
Seniors in particular, and then overall, if it's different.
That's a tough one. For seniors overall, it's probably chronic diseases, particularly things like high blood pressure, heart disease, and some cancers. So those are places where, though, from a public health point of view, they are the most difficult for us to try and help you with. We can give you information about it. We can, like for instance, we were talking about breast cancer. We can give you information about what is currently the recommendation on breast cancer screening, if for some reason you don't trust your own provider when you're asking them for that information. I think the other thing, though, with respect to seniors is probably falls. obviously, because that's why we're talking about it now. It's really a high priority. And then that sort of basic overall, these are choices you can make to live more healthy, because these healthy choices that can reduce the risk of you getting these chronic diseases. With respect to health problems in the county overall, certainly one of the most important ones that we're trying to deal with right now is the fentanyl epidemic. I'm actually writing a white paper on that topic to help educate or help inform our first responders about the particular risks that they might be facing when they're dealing with fentanyl and other illicit substances that are found. And another one, of course, that's really important is mental health. We're very concerned about mental health issues in our adolescents. And so we're working with the Douglas County Mental Health Initiative to find ways to try and promote mental health awareness and getting people to resources when they're having a mental health issue. For one thing, Laura and Alyssa and I and our other community health educators, we've all taken mental health first aid. We plan to become mental health first aid trainers, and we want to push mental health first aid into the community as best we can, because it is a way that you can help your neighbor if a mental health issue comes up.
Dan, can I add
yes.
something to that? So if you're not aware, as a local public health agency, we're required to do what's called a community health assessment and a public health improvement plan every 5 years. And so what we're doing as part of that process is taking a scan of the community. We're looking at data to really help inform us on what the priorities do need to be here in the county. So that process was done late 2021, beginning of 2022, to set us up with a 5-year plan that goes through 2026. What was identified in that plan as the 3 top priorities for the county was injury prevention. And under injury prevention includes falls in older adults. It includes substance misuse and overdose. It includes suicide prevention. So that all falls in that injury prevention category, along with motor vehicle accidents. That's something else we have a high prevalence rate of here in the county. Chronic disease prevention is the second priority. So it is looking specifically at hypertension, diabetes, and cancer prevention. Most commonly skin cancer prevention, because we have a higher incident rate of skin cancer here in Douglas County than the state average. Why? Well, think about all of our outdoor areas, right? We have so many different parks and trails and opportunities to be outside, but along with that comes sun protection and sun safety. So that's the second priority area. The third, as Dan mentioned, is behavioral health. So we're looking at mental health conditions, substance misuse, all of that falls in that category, and then also ties back to injury prevention. So right now we've been going through a strategic planning process with leadership at the health department, along with members of our Board of Health, with other community partners and governmental agencies, to really help us narrow down on what we want that focus to be this year and what's going to be longer range goals as we go forward. So we'll have more information soon on how we're prioritizing that, but that's what we're looking at every year.
Thank you, Laura. And one thing I want to add to that, and is that as a health department, building something new from the ground up, designed to serve Douglas County, we are collaborators. We are not siloed. We're not on our own. We are looking for every single partner we can find in our community so that we can help them achieve their goals with respect to healthy living, and so that they can help us along the way. So our collaboration with the Mental Health Initiative, our collaboration with the Senior Council, we are working with Douglas County Libraries to help find ways to promote healthy living through infographics or other things that might be done through the libraries. We're also working with recreation centers. So we have some of our healthy information brochures now posted in Castle Rock Health Rec Centers and some in Highlands Ranch. And we're also really interested in being in the schools. I have personally had some ability to interact with students at Mesa Junior High School, working on health-related projects with them. And we were recently at Castle Rock Middle School doing part of a health fair where we did a survey on vaping among middle school students. And about half of them said they either vaped or knew somebody who vaped. We know that vaping is a real big issue in Douglas County schools, and we're working to try and educate the kids so that they can make better choices. So, any other questions? Yes.
Once an individual falls, are there services that the county can help to, like life alerts that the seniors can have?
We are not directly involved in products like Life Alert. Laura, you might be able to speak to that better than me.
Would say Douglas County Aging Services is hands down your best resource when it comes to services and supports for our older adult population. They're just right across the parking lot here, but they've got access to a number of different resources and can get connected to referrals and things like that. So definitely use them.
I'm also right here and we have our resource guide with phone number. So.
Yeah. Good question though. And actually that's another example of how we're constantly looking for partners that we can collaborate with, whether we end up collaborating with you on issues like that or whatever, but we are reaching out and looking for people to reach out to us. We've only been doing this for about a year, and I've only been with the department for 6 months. So we're at the beginning and we're working hard and we're looking for moving forward with more collaboration and more partners. Anybody else? Did we have any questions from people online?
Luke?
I have no online questions.
Okay, good. So with that, I will end my presentation and I'll turn things back over to Gretchen.
Those reminders are very important, when talking about getting up slowly. My mom, before she passed, she was sharp as a tack till she passed at 94.5. But she was always in a rush. New York gal, right? Always in a rush. And we kept saying, when you get up in the morning, sit on that bed for a few seconds. Think about your day, say a prayer, do a few breathing exercises before you take off. Because mom would just be going 9 miles an hour. So that's a good thing to remember. I wanted to also remind folks that the tax assessor's office can be very helpful. I know there's been a lot of discussion recently about your property taxes going up and whatever. And if you are an older adult, a veteran, or a Gold Star spouse, you can have some tax exemptions that you might qualify for. And so if you get on the Douglas County Assessor's Office website, there's also a video there embedded in there. It can be very, very helpful to kind of mitigate some of those costs. So that's very important.
There's also the ability to challenge or to contest the new assessment and there's tools in there to help you with that. So
thank you for mentioning that. Yeah.
And it is right now probably important to do.
Yes, and I believe, correct me if I'm wrong, but I believe the deadline to kind of appeal is June 7th. So that's coming up 6 days. Oh, excuse me, the 8th? The 8th. All right, so we've got a week to kind of get on that website, get it all straight in our head so we can move forward. Yeah, that's a big shocker, I know. I had to sit down to read my letter. As far as fall prevention is concerned, we know how important that is. I don't know how many folks have heard about Nimble Science, but they have an app, a free app that you can sign up for if you're an older adult. It's very simple, cognitive and physical exercises, 10 minutes a day. It's actually kind of fun. That will help build those core muscles and keep you strong. They maintain that muscle strength. So that's something that's available to you here in this county. And any other questions that you might have for the Seniors Council? We meet every first Thursday, 10 o'clock, somewhere in the county. We kind of travel, we're gypsies. We like to visit all the neighborhoods. I also did want to mention Laura, you were talking about preventing skin cancer and how it's, there's a very high percentage of that here in Douglas County. One of the speakers that we're going to have at our Vintage and Vibrant, actually our luncheon keynote speaker is Dr. Carson Bruns with the University of Colorado out of Boulder. And he's going to be talking about, wait for it, smart tattoos. He's working on a tattoo that would be invisible on your skin until the UV rays start getting into the danger zone and you would get a visual. So that's either, get the heck out of the sun or reapply your sunscreen. He's trying to work on research to prevent skin cancer. So he's going to be one of our featured speakers. So another reason to join us on September 28th.
Laura, you better come to Vintage and Vibrant.
We're gonna be there.
So thank you so much for joining us in person today and also online. I guess we're going to be able to have the PowerPoint presentation available through what, our webpage, Kim? Does it work on a webpage or the YouTube channel? Or
Yeah, we'll attach it to the minutes, so.
attach it to the minutes? Okay, very good. And as I mentioned earlier, it is recorded. So if you want to, there's a lot of information Laura and Dan shared. So you can always review that again at a future time. We hope to see you next month when Tiffany's going to be talking about the unusual things you can find at the library. It's kind of surprising. It's more than just books and tapes these days. So we hope to see you next month in Parker. Thank you.
Thank
Thank you.